This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hi everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I'm not medically trained in anything. Thanks for joining us today. Once again, we have a super cool guest. This is a really interesting topic. Most of my friends talk to me about losing their pets, and it's losing a family member. So, Alice, who do we have on today?
Dr. Elizabeth Hugger is a regional veterinary director for Lap of Love, veterinary hospice and end of care life services in your home. We've all been through the loss of a pet. To have to bundle that pet up, if it's a cat, put it in the carrier, then it gets afraid because, oh no, I'm going somewhere strange. Or you've got a big dog that you can't lift. Lap of Love comes to your home and provides you with an in-house end-of-care service. And I have to tell you, it's a much-needed service. In human medicine, we have hospice. Lap of Love is hospice and end-of-life care. And Dr. Hugger is a graduate of Texas A&M. She did her undergrad at University of Florida and her vet degree at Texas A&M. And she's a regional director for Lap of Love. We're so happy to have her today and make everyone aware of Lap of Love and the service that they provide in the very stressful and emotional time that we have when we lose a pet. So welcome, Dr. Hugger. We have a lot of questions about the service because I think it's so important for all of us because like you said, Janet, this is a family member.
Yes. And when it's 11 o'clock at night, like with Shaggy, and he was really sick, and I didn't know what to do, and I knew there was a vet that would come to my home, and I called and I said, you don't know me, but... Yeah. And he said, I'll be right over. And I mean, I was so grateful.
It's never a no. It's how can we help you? Yes. So welcome, Dr. Hugger. Thanks for coming and doing the show today. You know, I was telling Janet, it's such an emotional time that it's so wonderful to have Lap of Love. And I just want people to know about it.
Mm-hmm. I'm excited to be here and to talk about this service because it's a passion of mine for sure. So I'm glad to be here.
So tell us about Lap of Love. How does it work? How did it get started? Right. What do you all do?
How do you call you? Do you email you? Yeah. What?
Okay, so when people are looking for our services, most of the time people hear about us word of mouth. Yeah. That is by far how we get the majority of our referrals. Mm-hmm. The other way is just through referring veterinarians. Mm-hmm. So oftentimes, I think about 40% of our clients come from veterinarians that say, you know, I know that we're coming close to the time and I know being at home is important, call Lap of Love, and they'll provide our information. So we do have a website, and that's probably the easiest way to get some general information. It's at lapoflove.com, and it really will provide all information in terms of what our services are, what we can do, because we are actually nationwide. Mm-hmm. We started here in Florida, in the Tampa area, actually. Our co-founder, Dr. Danny McVitie, she pretty close out of vet school. She was working in emergency medicine, and she had an owner come in she tells this story where she had an owner come in, she had this poodle wrapped in a blanket in her lap, and she knew that it was time. And they were in the clinic, and the owner she said, is there any way that you can just leave her here on my lap? And that's how Lap of Love got its name.
Oh, that's beautiful.
You know, just being really what we are dedicated to preserving is the human-animal bond. Mm-hmm. That is something that is just so important, and really that bond is undeniable. Yeah. And if we can help make this process a little bit more manageable, you know, we're never this time in a family's life with their pets, it's never going to be good. So
There are never
you
any
know,
words either.
it's
There's
not.
no
And
words. Mm-mm.
so really what I always said to families, and when they asked, how I can do this and how can you, my focus and my goal and my answer was always that it really is just an honor for me to be able to be here.
I agree.
And
Can I tell you, Elizabeth,
Yeah.
when my father-in-law passed away, I've told this story on the show before. We walked out of the room and the funeral director was there. And I said to him, gosh, I don't know how you do this. And he said the exact same thing. It is my honor to be with your loved one at this point in that person's life. How true is that?
yeah, it
Ah.
it is. And if we can make an unbearable situation bearable,
Yeah.
that's really always what my goal was. And so so that's who we are, and we
Yeah.
we
Yeah.
offer services everywhere like that. We want to be able to provide whatever it is families are needing when they're coming towards this stage or this season of their pet's life. So everything from in-home hospice care, which basically is when we're coming to the end, there may be a couple of things that we can do and try to help improve quality of life for a short period of time. And if we can do that, that's kind of where we are with hospice. We also have a tele-hospice service where families can call in and speak directly with a veterinarian. And it's very much a quality of life discussion.
Yeah.
And it just gives families a little bit of direction in terms of where are we, what may be the options, and are we getting to the point where we really need to start thinking that we need to make this really difficult decision. So we walk families through that time, and then we do have our in-home end-of-life services, so our in-home euthanasia services. And then after that, we also provide pet loss support and grief support for families.
Wow.
And that's not just for families that are lap of love families, but it's available to any pet parent that has lost a loved one that is just searching for support. We have that as well. So
It's really wraparound services.
Yes.
Yes. And then I also love that you have a memory gift, which I think is really sweet. Because when our Shaggy, it was my first time with euthanasia, and I had no idea what I was getting into. And then, like a couple weeks later, this little package arrived, and I had no idea that was happening, and it was just the sweetest thing. And we now have all of those little paw prints on our Christmas tree.
Yeah.
That's where we put them. And it's just it was really touching to get that. I had no idea it was coming, so it was a lovely surprise.
yeah, that is actually, we leave those paw prints with the family in the home when we make them, so that they have that at least tangible memory afterwards.
It's such
What can I ask a technical question?
Of course.
So do you also take care of the body?
We
Because
do.
I think a lot of people don't know what to do.
Yeah.
Or like they'll wake up in the morning and the dog had passed away on its own.
Yeah.
And they don't know. Do they call the police? So would they call you for something like that as well?
So good question, and the answer is twofold. So if we are providing end-of-life services, yes, we absolutely will provide aftercare services if the family so wishes. Sometimes families wish to bury them themselves and handle their own aftercare, which is totally okay and appropriate. But oftentimes they will ask us to handle those, and we do have trusted funeral home partners in all of our locations that we work with really closely. And we have very high standards, I will say, with what partners we will work with because we are very particular. And so, yes, now the flip side of that is if a family has noticed that their pet has passed away overnight, for example, in those cases, they certainly can give us a call and ask for guidance, and we can guide them to the certain funeral home partners that are local and give them a little bit of guidance on whom to call in those instances.
Now, is there, and I'm sure this varies by location, but is there a fee?
There is, and you're exactly right. It does vary by location. The last number I heard, I believe we're in 35 or 36 states. So we're quite spread across the country, and so those prices are variable depending on the location. So the easiest way to be able to find out the prices is to go to our website, and you can just, for families that are looking, right on the very first page, you can type in your zip code, and it'll bring you to the appropriate page, and it'll show you the doctors that are available in your area with a little bio about them. It'll break down the prices, and all of that information, and the local area phone numbers that you can call.
Well, I also like that this booklet you provide has information on your other pets, because it was a huge loss when we lost
Right.
Boomer, and Shaggy was the littermate or brother, whatever you call it.
Yeah.
And
Wait a minute.
you know, Shaggy came, like the whole personality of the house changed because of that. You know, and we weren't prepared. We didn't know what was going to happen.
It's interesting, right? And sometimes I don't know that we give our pets as much credit as I think they deserve, but they absolutely mourn in their own ways.
Yeah.
Oh, absolutely.
You know, there are certainly going to be some pets that will move on with life as though nothing happened, and that's okay too, because there's also the flip side of that. Some pets are really affected by it and really mourn that loss, and every family is different in terms of whether they want their other pets to be present for these sorts of services or not. But we certainly welcome that if that's something that the family is asking about, and we are certainly open to discussing that too.
Well, and we had my friend Catherine on, who is a master's in social work, who talked about how she handled it with her children, and how she works for Cornell here, and works with the veterinarians and patients that are going through pet loss. So it is a whole wraparound that you provide, which is really something.
You know, too, Janet, I have some friends now that I'm retired. Jackie, that used to work for me.
Yeah.
Jackie always had golden retrievers.
Yeah.
And now that she's, late 70s, I don't think she'll mind me saying that, she didn't want to get another
Say
golden.
mature.
Mature. Because you can't pick that dog up.
No.
If something happened to the dog, she can't pick it up and take it to the vet, where I think that's a wonderful service that Lap of Love provides, because her one dog had bone cancer, osteosarcoma, and broke his leg because of, the weak spot and she couldn't get him in the car. And so this service comes to you. I mean, that's invaluable as far as I'm concerned.
So how does it work? Say I'm in one of your towns, and are there local veterinarians that work for Lap of Love that are sort of like on call?
Correct. Yep. We have in each territory, we often have multiple veterinarians that are available. And so when you call into our support center, we have a support staff that it mans the phones, and so you will talk to a live person. You don't talk to a robot.
Can I tell you, when I called to get you on, the person was so nice. I wanted to keep talking to her. She was the softest, most comforting voice, Janet. How can we help you? So kudos to her.
Thank
Go on,
you.
Dr. Huger. Yeah.
No, absolutely. They're incredible. And so they basically will look to see who we have available, what the schedule looks like, and we'll talk with families to try and schedule a time that really works best.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
So what are some of the things that hospice care entails?
Yeah, it's a good question, because I think there is a little bit of a disconnect between what we can provide with veterinary hospice versus human hospice. And many of us have the experience with human hospice in terms of where a nurse comes to the home and provides nursing care and providing IV medications and things like that. And that's it's a little different in veterinary care. Veterinary hospice, the owners are really in charge of caring for the pet in that nursing care. Now, certainly we are focused on palliative measures. So are there medications that we can provide to help with any of the symptoms that these pets are exhibiting, whether
Like vomiting
that's
or
pain,
something?
vomiting,
yeah.
inappetence, absolutely. And additionally, though, the real benefit of having a veterinarian come to the home is also the veterinarian can see the environment and see, are there some opportunities for maximizing the environment to help this pet? For example, if you have a pet with mobility issues and they're on tile floor, well, there's an opportunity for yoga mats being placed, or carpet runners, or there are like pads for the feet, things like that that can really help them get around, that can really make a difference. For kitty cats, for example, if they're having a hard time getting around and the veterinarian notices that the litter boxes are on top of the dryer, being able to lower those and kind of cut the sides out of the litter boxes to make them more accessible. So things like that you can see when you're actually in the pet's environment. And so those are the things that we really focus on. Are there some palliative measures in terms of medication? Are there some environmental management techniques and tools that we can utilize?
And some of those are just little minor changes that can make a big deal.
That's exactly just the little thing for a big dog, for example, raising the food and water bowls off the ground so they don't have to lower their head as far, when they're getting a little bit older and painful and a little creaky. So there's a lot of those sorts of things that we'll discuss when we're in a hospice appointment.
It's kind of like when visiting nurses came to mother's house,
I know,
or mom's house, and we had said we should probably move those throw rugs, right? Wipe out. But when the visiting nurse said to move it, of course
I know they don't listen to us. They listen to yeah.
We have to have the official come through, right?
Do you ever do exotics? Do people call you for that, like ferrets and things like that?
We do. They're a lot less often. It's a smaller percentage of our appointment volume, but we certainly do have lots of doctors that are happy and willing to see birds and ferrets and pigs and hamsters and, all sorts of, we've had fish, so people love their pets. And so we certainly want to be there to help. So,
go ahead, Janet.
No, a lot of people really want their pet to die naturally.
I know.
So
and at the pet's expense, even though the pet is suffering, because they don't want to have to deal with it. I know.
They don't want to make that decision.
Yeah.
Right? And I remember when Shaggy it was bad and he had a hard time breathing, and the vet I had on the phone that was going to come over said, "Can I just listen?" And he goes, "I need to come over. That dog is suffering."
Oh.
And I'd never met this man before, and he was fabulous. So
I bet education is a lot of what you do.
What do you tell him?
Yeah. So there are lots of times when families are unsure, and and that is part of what we do. And as a veterinarian, it's educating clients and helping them understand what's happening. And you had mentioned that natural passing. I think we all want to fall asleep and not wake up, right? That is what we want. But unfortunately, natural passings are by and large not peaceful. And so helping families understand that, what we are able to provide as veterinarians, we're the only medical practice that is legally allowed to take a life, right? And I take that extremely seriously.
Yes.
And I know every veterinarian does.
Yes.
And with that, we're not only able to stop suffering, but we can help prevent it from occurring in the first place, which is actually part of our veterinary oath, is to help prevent animal suffering. And so I feel really strongly that it is much better to make this decision a day too early than a moment too late.
Totally agree.
Sure.
Because you regret that the rest of your life.
Yep.
Why didn't I do that sooner? And I've told, even though I'm in Durham and we have very few losses in Durham, thank you, God, people for some reason always called on me to ask me stuff. And I'd say, he's not doing well. All right, let's give him a day. Let's see. And if he doesn't turn around, because sometimes we all have a bad day, let's face it. Right. But when it's a terminal disease, like a hemangiosarcoma or something, and you know that they're not going to get any better. And I have to tell you, Janet will know about this. When our father was dying, he had at the end he had liver cancer, and the resident that was taking care of my dad at the hospital, he was hospitalized, and my dad was kind of out of it because they were giving him morphine drip. and they wanted to put in a feeding tube. And I had to fight with our older sister. The man is terminal. The only thing this man ever complained about was the NG tube, the nasogastric tube, that it bothered him. I am not putting him through something that bothered him when I know, and I'll tell you, Dr. Hugger, it was a fight with that resident because legally they wanted to do that, and I said, and I was so mad at myself because I got teary-eyed because I was fighting it. I said, I will sign anything you want. This is not on you. This is the family decision. And then my older sister said, well, I said, Penny, this is not TV. This man is terminal. We need to do whatever he can. And we refused the feeding tube. But it was a fight.
Well,
and thankfully in our profession, we know when it's the end.
Yeah.
And we don't have these legal things of, let's put a feeding tube to prolong life. No.
But I will say, as a pet owner, it is comforting. Like when we had to put Smudge the cat down, or Dexy the cat down.
Yeah.
When my doctor, my veterinarian looked at me and said, it's time.
Oh, absolutely. I'm sure, Dr. Hugger, with your pet and with my pet, I want my friends who are vets to say, you know, one of mine had a brain tumor, 15-and-a-half-year-old golden, and Dr. Heidi Ward, my classmate internal medicine specialist, said, Alice, you know what this is. And just those words.
Yep.
I just needed somebody to double check me and tell me, yes, that's the right thing to do.
Yeah.
100%. I mean, I can even speak from my own experience, right? That when I have my own pets, I all of a sudden cannot be a veterinarian for my pets, and I cannot think that way.
Right.
And so I need my veterinarian friends to be able to say, look, Elizabeth, like, this is where we are. Like, it's time, and it's okay.
Yeah.
And so being in that space also helps me to be a better doctor for my clients too.
You've been there yourself. Yeah.
Yes, you can help them. You know exactly that pain and the difficulty of making that decision and that question of, is it too soon or is it too late or is it time, and being able to sit in that space.
Yes.
Can you walk us through the process? Now, I've experienced it, but a lot of people, I didn't know what I was getting into the first time.
That's a good question, Janet. Yeah.
Absolutely. I'm happy to. So typically, a typical appointment, for example, there will be a first medication that will be administered underneath the skin, just like giving a vaccine. And in that medication, there's pain medication, there's sedation, and it's really just to help them relax. Many of these pets have been uncomfortable, not feeling well for a long time. And at this time, they're really able to relax. We can remove that discomfort, really let them kind of settle into that feeling of just painlessness. And then, once they're ready and once they're feeling really good, then we move forward with the second medication, which essentially is an overdose of anesthesia. It really travels to the brain first, and it shuts things down from the brain and then shuts down the other body systems.
Is that IV again? That second?
So it depends.
Okay.
That's a good question. So many times, yes, it is IV, but we do not place indwelling catheters like many hospitals do. So we find that actually causes a lot more stress in terms of having to hold the pet and, being able to gain IV access while they're, struggling. So we try to avoid all of that manipulation if possible, which is why that first medication is just given under the skin, just really easily. And then that second medication just depends. There are oftentimes some of these pets that are so sick. Some of these kitty cats that have chronic kidney disease, have terrible blood pressure and are really dehydrated. So venous access is really just not an option. But we can give the medication in other locations and, totally peaceful, and they don't feel a thing, and they just kind of drift off. And so, that second medication can be given in several different locations.
So before all that happened, we were given Shaggy chicken skin, all the good stuff, right?
Yes.
Still had an appetite. And and that's something I think you just do as a pet owner, right? Because you're spoiling the bejesus out of them.
Food is love, right?
Food is love.
Yeah, exactly.
Love
so
them
we
like
encourage
family,
it.
Treat them like family.
That's right. We encourage treats, and many of our doctors bring treats for the pets because we just want them to be feeling as good as possible.
So
Did you ever? Go ahead, Jan.
Do you have any advice, like, couple of my really good friends, you know, the dog was drooling, the dog was losing bowel control. I mean, it was bad, right? But the pet owner wasn't ready. So do you have any tips on how to talk to a friend or a family member and say, hey, like, look at how
This is bad.
This is bad. Look at Fluffy here.
Yeah.
I can't take it anymore.
It is absolutely challenging, right? When you can see what somebody else doesn't see. But I have spoken with not just clients, but a lot of friends and family call me when they are getting towards this time, given what I do. But I oftentimes encourage families to think about quality of life. And I like to give them something that's very tangible to consider. And so what I ask them are, what are the 3 things that Fluffy loves to do? What are those things that historically are his favorite things, whether that's going for a walk or eating or going for a swim or chasing the ball, whatever those 3 things are, what are those 3 favorite things? When he can no longer enjoy 2 of those things, my question to you is, do you think that his quality of life is good enough anymore?
Yeah.
Because I would challenge that maybe it's not.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
The other thing is, like, for example, let's go back to the kidney failure cat. They lose their body mass, they get dehydrated, their skin and bones, and the owner has been living with this, and they don't see because they're living with it every day.
Right.
Then a stranger like Dr. Hugger or Dr. Droman or Janet walks into the house and like, oh my God, you know, because they're not seeing the change.
Yeah.
Yeah, that is certainly challenging, and oftentimes, sadly, we do see an uptick in appointments around the holidays, and I think a lot of times.
What is that?
I know.
Because
It's like the
family
pet's gotta
members.
go. First thing gotta go. I got too much to do. And the pets,
No.
I agree, Dr. Hugger. I
No,
would tell
but
my
Alice,
girls.
I'm not
What?
saying that. It's not that. You hear, like, I have a lot of humans that die around that time of the year, and pets, there's something about the holiday time.
Well, I'll tell you my thing. Even in Durham, I noticed that, all of a sudden, we got family coming and everything, and now the pet is too much trouble. And
Oh, my God.
I know. It used to, as vets, we could, all of us would agree with that. Wouldn't you, Dr. Hugger?
Yeah, and I think also when you have holidays, there are also people that you don't normally see that are now seeing the pet that haven't
Yes.
seen them in the last 6
Yeah.
months, and they're saying, what are you doing? Look how rough she is.
Yeah.
And I think that also plays
Yeah.
into it as well.
Yeah. Holidays, yeah, I agree.
Yeah.
Yep. What pets do you have, Dr. Hugger?
So right now I have one dog. She is a terrier mix. That, whatever was walking by that day, who knows what she is. And she's 13. She's an old lady. And, we used to have 4 dogs, and she was the terror of all of them. She was the bad girl. And now she's the good dog. I don't know what happened.
What happened there?
I don't know. And then we also have 2 tortoises. So we
Oh,
have.
I love. How old are they?
They are, about 10. So
Are they in a cage?
they are outside. We've built a garden for them outside, and so so they live until it gets below about 50. Then we have to bring them inside, and so we have like one of those plastic baby pools. We put it we put it in the house, and they sit in the baby pool in the house until it warms up a little bit. So
They're fast because I volunteer at Crow, and sometimes we're doing like tortoise day, so we take them out to exercise, and I'll be talking to another volunteer, and I'll turn around, where is he? I mean, they can really scamper off, and I'm like, oh my gosh, I'm the vet, and I don't want to lose one of the tortoises.
you are Crow in Sanibel?
Yes, that's where I am.
Oh, okay. We were just in Sanibel 2 weeks ago.
For what? Not the shell show. That was last weekend.
No, just because
Hanging out.
we have a year-old son, and took him to the beach for the first time.
Oh, if you can, look up the Sanibel Sea School. And when he's a little bit older, I want to go there because they have wonderful programs for kids. It's a great learning experience. And the Shell Show is the first weekend of March. That's adorable too. He'd love that. Not when he's 2, maybe 3, 4.
Later.
Yeah.
Oh my goodness. And it's funny you mentioned Crow too, because when I was in vet school, went through the match and was looking at Crow as one of the intern possibilities. Yeah, I ranked them at one point, who knows where, but
Yeah, it's wonderful. There's nothing like it. When I go back to Ohio, when I go back home and there's an injured animal, the closest thing to me is Back to the Wild, which is about an hour and a half away. But Crow, my husband and I were going to Venice, and we were ready to get on 75, and there was an injured tortoise, one of these big ones, that was hit and left for dead. And I can't tell you how many runners ran by and didn't do it. I yelled, "Turtle!" And he pulls over as soon as he can, because you know how everyone here goes 80 miles an hour. And I ran and I got it, and the left eye was gone, and it was bleeding from its side. And thank God, Blue Pearl, right by 75 there, will take wildlife, and then Crow comes and picks him up. I don't think he made it. I didn't call to find out because I didn't want to go through the sadness of it, but at least we got him off. He wasn't on the road. He was hit and probably walked over, but yeah, it was bad.
It's rough.
But Crow is wonderful.
Yeah. Good.
So, Dr. Hugger, I'm going to ask you the questions we ask all of our
yes.
guests. Okay. Well, thank you for joining us, and we really appreciate it.
I'm so excited about our tortoises.
Thank you for having me. Tortai, yeah.
Tortai.
Okay.
What makes you passionate about your work?
Oh,
Yeah.
I already know that.
I was in small animal GP prior to coming into Lap of Love, and I can remember very vividly a gentleman, older gentleman whose pet was not doing well, little poodle, and we ended up having to say goodbye and really walking him through that process. And it was really sad because this was his only companion in life. Yeah. And it was just heartbreaking. And he came back the next week just to bring me flowers, to say thank you for that. And to know that, I was the one that ended his pet's life, his companion's life, and he was thanking me. And I just felt that was the moment when it almost was like a light bulb went off that there's something here.
Yeah.
And this work is not for every veterinarian. But there are certain people that it's made for.
Yeah.
And when you feel like you really have found your passion and your calling within the field, it's really special.
It is a calling. It's not a job. Anybody that calls this a job, they have no clue. It's a life. Yeah.
Oh, wait a minute.
Do you ever worry? I had a client, a young man. Oh God, is this the one with the paunch?
No, but her eye looks red, doesn't it? Look. No, this is.
Janet, you're such a client. Hold him up to the camera so we can see him. I can't see him, Janet.
Right, you can't see right there that redness.
No,
Right
pull
there.
the lid down.
Well, good luck.
You got it? I can't.
Hi. Okay. Bye bye.
Anyway, what I was going to tell you real quick was I remember having a client. Remember, I'm in Durham, so I had a young man, and I think he had a Springer Spaniel. And this guy would do anything. I don't think he worked, okay? I think he was on mental disability. And he would do anything for this dog. So to give that dog the 6-month heartworm preventative shot, I don't know why that was done, okay? Because this guy would get up at 2 a.m. to give any medication at any time of day. So monthly heartworm preventative would have been great for this dog. Well, it had a reaction, and it died from that. And I reported it to the drug company, and I worried about him because he tried to tell his regular vet and the drug company, the dog's never been the same since it's gotten the shot. It started like 3 days after. And I called him, I think, every day for 3 weeks because I was worried about him after he lost this dog. This dog was everything to him. And he was a young man with, I know, some problems. And he did okay, but it was tough. Yeah.
That human animal bond, right?
Yeah.
It is
Yeah.
so strong.
Yeah. I was afraid of what he was going to do, really.
Yeah.
So our next guest question is, what is your pet or human peeve?
Pet peeve. Ooh.
Pet or human?
Or human.
It's not the terrier, because the terrier's a good girl now.
Yeah, she's a good girl. Yeah, I can't pick on her anymore. Man. I wish I could come up with something really clever, but I've got nothing.
See, that's a happy person.
That's a happy person. We've had people
I'm
complain
always
like
annoyed by everything.
that people don't use their blinker, things like
Well, I work from home. I hardly drive anymore, to be fair.
In Florida, and that's a plus in Florida.
Well, the other day I was in Pilates class, and we're a group where we see each other every single morning. And then one woman said, I just have such anxiety. And I said, she goes, what do you have anxiety about? And I went,
There you go.
kind of nothing.
Yeah.
I said, like an MRI puts me over the edge, right? I said, but how often does that happen?
Right.
And I just said, not a lot. Like, not a lot. And she's like, how do you do that? And I go, like, a lot of stuff's out of your control. Like, let it go,
Yeah. Well, that's easy to say, but
Right.
yeah.
But she said, I am anxious all the time. I would go, like, out of my mind.
Yeah.
I think the
I would
only
change
time
my diet.
Well, the only time I've experienced anxiety is I'll never forget when they announced that COVID was a pandemic, worldwide pandemic. And I was sort of like, now what? Because we'd never been through that, right?
Yeah.
I got like a little like, how's this going to work?
Yeah.
And then it was like, it just kind of rolled out, right?
Do the tortoises have names?
Yeah, what are their names?
Maple and molasses.
And you need to send pictures. I happen to love tortoise pictures.
Okay, I
Yeah,
will
'cause
send
we'll
pictures.
put them up on the screen, and we'll
we
put your
will.
website up too, and watch. Thank you so much for this.
Yeah,
important
I
work.
hope we get to meet someday. If you ever come to Sanibel again, I'm here till first weekend of May, then we head back. But that Venice house, you'd probably pass through Venice on the way to...
Absolutely, yeah. No, Venice is not far from us. We drive to Naples a lot. My brother lives there, so we pass Venice all the time.
That's like going to the Mideast. I mean, because it takes forever to get there. I have to tell you, I was walking the beach this morning listening to a webinar, because that's when I get a lot of my vet listening stuff in. And I met this couple from Lancaster, PA, and we just got to talking, and she was saying how nothing is really built back here. And I'm like, yeah, you're right, it's not. And so they asked me about stuff to do, because they leave Saturday. They are there with another couple. They were going to go to Naples. I said, plan on spending 4 hours in the car, 2 hours, 2 hours back.
Yep.
I said, why don't you do Captiva cruises? You can take the boat to Boca Grande. You rent a golf
lunch,
cart,
come
have
back.
a fun day. And they're like,
Yeah.
oh my gosh, the other couple, he was in the Navy. He would love to go. I said, then do it. Because Naples is fun, but at this time of year, it's
a lot.
Dr.
It's a
Hugger, if
lot.
you're driving to Naples,
It's a lot, yeah. It's
Well,
busy.
thank you so much for joining us. We so
send
appreciate
pictures.
I will. Thank you for having me. I really appreciate it. It's been lovely.
Oh, I love
It's
what
been
you
a pleasure.
do. I honor you for what you do, and I'm so glad that you came on, because our listeners really need this service. And if they don't know about it, go on the website. We'll put it on. Our producers will put it on the media information. But thank you so much from
Thank
the
you.
bottom of my heart, really.
So, Alice, wrap it up.
Thank you, Dr. Hugger. This is Dr. Alice Novotny-Jeroman from Cleveland, Ohio, saying.
And Janet Novotny King from Cleveland, Ohio, saying thank you for listening.
Thanks for joining us. Please send us your questions. We're happy to address them on the show. And we love our listeners. We love our listeners' pets. And we can't wait to see Dr. Hugger's tortoises.
Thank you.
Thank you, ladies.
Bye.
Appreciate it. Bye-bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.